I call the member for Wills.
Thank you, Deputy Speaker. Medicare and bulk billed urgent care clinics are so important for many in my community after suffering a decade of cuts from Peter Dutton and the previous Liberal government. For too long, families, pensioners and vulnerable Australians in my electorate of Wills have struggled with rising healthcare costs and a decline in bulk billing, the direct result of a decade of coalition of Liberal neglect. The former government froze Medicare rebates and ripped billions out of primary care, causing gap fees to plummet. For years under the coalition government, my community told me how expensive it was for them to see their GP and how less and less GPs were offering bulk billed services. I've been strongly advocating for an increase in bulk billed appointments and free Medicare urgent care clinics to ensure that people in my community of Wills have access to quality bulk billed healthcare when they need it. Free Medicare urgent care clinics allow families to access bulk billed healthcare without waiting hours in an emergency department. We have one just in our community, near our community in Carlton, which serves many in the south of my electorate. Under the Albanese Labor government, remarkably 87 clinics have opened across the country, treating over 1 million Australians for urgent but non-life-threatening conditions: burns, cuts, broken bones. Every visit is fully bulk billed. You don't need your credit card, you just need your Medicare card. So for my constituents, this will mean faster access to care and less pressure on hospital emergency departments. It means parents with sick kids aren't spending hours in a waiting room. It means older Australians aren't skipping the doctor because they can't afford the gap fee. The Albanese Labor government has also made the largest investment in bulk billing in Medicare's history and tripled the bulk billing incentives so that those who rely on their GP most, the pensioners, kids and concession card holders, can see a doctor without worrying about out-of-pocket costs. But while Labor is strengthening Medicare and building free Medicare urgent care clinics, we've got Peter Dutton as Leader of the Opposition, who spent a career trying to tear it down. As Health Minister, he tried to introduce a GP tax, forcing people to pay every time they saw a doctor. He cut $50 billion from public hospitals. He's voted the worst health minister in Medicare's history by Australian doctors, and he tried to destroy Medicare before. We're not going to let him do it again. Labor built Medicare, Deputy Speaker. Labor built Medicare, and only a Labor government will protect it and strengthen it.
Thank you.